Hello, good morning. I am Dr. Tessy Oiza Ahmadu. I'm a clinical and radiation oncologist. October is Breast Cancer Awareness Month. Let's talk breast cancer. A breast self-examination is actually one of the simplest and most convenient way of checking the breast. A woman is supposed to have a breast self-examination at least once in a month. The best time to have a breast self-examination is 5 to 7 days after the menstrual period. As for women who are still menstruating, they do it 5 to 7 days after the menstrual period. This is because at this point, the breast texture is softer and easier for one to detect any abnormality. For women that are postmenopausal, that's women that have stopped seeing their menses, they can take a specific time every month to do this, because for them there are no hormonal changes any longer, and so the breast consistency or texture is the same all through. So they just choose a convenient time every month to have it done. A self-breast examination is advocated for women because more than 90% of women who come in with early signs of breast cancer, a lump is what is detected. So breast self-examination is advocated so that women can always have their breast checked monthly, so that they know what the consistency of their breasts is, and then they can always detect an early symptom of breast cancer and report almost immediately. So it is simple, it is very convenient, and when women do it well, it is a very important way of detecting breast lump or any breast change in good time. When breast cancer is found in a woman or even a man, because men too can have breast cancer, though not as common as we would find in women. But if breast cancer is found, the first thing is to have the woman staged. And what this means is you want to know the extent of the disease. How far has the disease spread? Is it still confined to the breast? Has it left the breast to the surrounding lymph nodes? And then has it even gone beyond the breast and the lymph nodes to other distant organs? So once that is done and the woman is properly staged, of course, at diagnosis, you already know what type of breast cancer the woman has. There are different types of breast cancer, and these different types would also suggest what form of treatment, what form of drugs the disease is amenable to. So once the diagnosis is made and the breast cancer has been classified into the specific type, and then the staging has been done and an appropriate stage has been allotted to the disease, then you can decide on what the treatment modality for this person will be. Stage is so important because the different modalities would come in combination or alone depending on the stage of the disease. And so if it is an early stage, that's the stage 0 or stage 1, then you're talking about mainly surgery as the modality of treatment. Surgery, and then you can have also radiotherapy after the surgery. That's for those that are going to have breast conservative surgery. For those set of people, you don't need to have a complete mastectomy. That's a complete removal of the breast. So these are for very early stage disease, mostly stage 0 to stage 1, and surgery and radiotherapy can be given. Once the disease is more extensive, and extensive I mean you have, there's the lump in the breast, depending on the size, also depending on the structures that are involved, and even if it has moved also to the draining lymph nodes, which is in the axilla, then you have to start thinking of other modalities of treatment like chemotherapy, using drugs, also targeted therapy for the receptors that this breast cancer express. Like I said before, once you classify them, then you know the receptors that they are positive or negative for. So there are some targeted therapy that will target some particular receptors that are overexpressed. And so when you have patients with such kind of tumors, then you will have to also give targeted therapy in addition to the chemotherapy. There's also hormonal therapy for those who express estrogen or progesterone receptors. These are the commonest subtype of breast cancer, and you can have them in about 70% of breast cancer they express hormone receptors like the estrogen and progesterone. And for those set of patients, you would need to also use hormonal therapy. There are also other immunotherapy that are available. So it's a combination for most cases. To treat a cancer, breast cancer in this context, is not a single modality. There are a combination of modalities that have to be used to be able to treat and attain cure. If that's it. And then for those that are of late stage, maybe stage 4, the disease has already spread to other distant organs, you can have radiotherapy to palliate pain, to help with the pain. They can also have some simple surgeries, especially like when the tumor is fungating, the tumor is smelling, it has opened up and all that. They may have to have simple surgeries just to help to make the woman more comfortable, less pain, and able to stay around people and not smell or not have the fear of being stigmatized. Patients have supportive therapy using pain relievers, and we mostly don't talk about this drugs, but for patients who present in the late stage, pain therapy is one of the most important things that they get as part of their supportive therapy. So these are some of the modalities that we use once a woman is diagnosed of breast cancer. The proportion, types, and how you consider which of them to use and in what combination will definitely depend on the subtype of the breast cancer and of course the stage of the disease and what exactly is your intent of treatment. Is it cure? Is it palliation? Do you want to achieve cure? Do you want to control the disease from progressing, or you want to just palliate the symptoms in patients who present in late stage? Apart from the drugs and other modality that we've spoken about and also managing pain, there is a very important aspect of treatment that we often may not talk about, but it's a very important aspect of the treatment of cancer, in this context breast cancer: psychotherapy. There's a need for psychotherapy once breast cancer is diagnosed. Psychotherapy, I mean, speaking to the mind of the patient, helping the patient to build a good mindset from the beginning of the diagnosis up until treatment and then survivorship. There are so many things that goes on when a diagnosis of breast cancer is made. A lot of patients go into denial. They have to be supported psychologically. They have to be spoken to, and even in the course of the treatment, to accept the diagnosis in the first place. This is one thing that has also even made presentation late. Patients, of course, notice the lump and all that, but because they have not accepted it, or they are not in the right frame of mind, they would hardly present. And even when they present, accepting the form of treatment you want to give and all that is also a problem. And their psychological demeanor throughout the time of the treatment is also very important. So psychotherapy is one form of therapy that is important from diagnosis till the end of treatment, and even after treatment at survivorship. A lot of patients during the treatment period go into depression, or they have anxiety, and all these have to be managed. So psychotherapy is one very important aspect of the treatment. And depending on the severity, there are even times that apart from the psychologist, the psychiatrist will need to see a mental health specialist and even give drugs.